So let's call the meeting to order at 6:30. And who wants to do the roll call, Rita or Mike?
Sure, I can do it. I'm going to do an order of where my Zoom pictures are. So Commissioner Burnett.
Here.
Commissioner Gano.
Here.
Commissioner Chair Bottenberg.
Present.
Commissioner Barnett.
Here.
Commissioner Heilman.
Here.
Commissioner Meir.
Present.
And Vice Chair Commissioner Nishioka.
Here.
Great.
Okay, we'll start with the Pledge of Allegiance. Stan, you're back. Mike, do we have a flag?
One moment, Chair. I will get that pulled up for you.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you.
Thank you. Okay, we will have the approval of the agenda. Do we have a motion? Okay.
I'll move that we approve the agenda.
Thank you, Julie. Do we have a second?
I second it.
Thank you, Rich. Is there any discussion? There being no discussion. Well, all those in favor of approving the agenda as presented, say aye or raise your hand or wave.
Aye.
Aye.
I call that unanimous. And we have the approval of the minutes of the December 8th meeting. That seems so long ago. Do we have a motion to accept the minutes? Who was present? One of you was present.
I'm sorry, I'm in Hawaii and I'm using my iPad, which I don't normally do, and I'm having a hard time figuring out how to see the agenda and the documents at the same time as I'm seeing the Zoom. So I'm going to not, I'm listening, but I'm not participating till I kind of figure, I mean, I'm not going to speak as much until I figure it out.
Okay, those present at the December meeting were Julie and
Yes.
Rich and Jody. So one of you, who wants to,
I'll move.
okay.
I'll second.
And who we saying was first? Jody, did you make
Yeah,
the
it was
motion?
me. I'm sorry, Jody. Yes, sorry.
All right. Is there any discussion to the minutes? There being none, all those in favor of the minutes as presented, please wave your hand. Okay, that looks like a 6-0, was it? 6-1, 6. I would call that an abstain there. Okay. We move to public comment. Is there anybody out there, Mike?
There is currently nobody here for public comment.
Okay. Then we move to new business, and the fun one is introductions. I think there's somebody in the middle of my screen who hasn't been here with us, who's coming to us all the way from Panama. So do we want to go around and let's see now, who wants to start? I have Julie at the upper left. You want to say who you are and a little bit about your background so Mark knows who you are?
Sure. Hi, Mark. Nice to meet you. I'm Julie Varness. I guess, just finished my first year on the commission. So I started last year. Been in Sammamish since 1994, raised my kids here. So very passionate about the community and making it the best place for people to live. So I'm looking forward to working with you.
Great. Thank you, Julie.
Rich?
Hi, Mark. I'm Rich Benak. I've lived in Sammamish since about 2001. I also raised my family here, kids, sent them to the local school. And I'm passionate about how we can use our human services to make the city of Sammamish even better.
Thank you, Rich.
Stan?
Sorry, I had to unmute. My name's Stan Gano, been around Sammamish since '96. Been on the Human Services Commission when we started, wasn't on the task force. This is my community and I want to share it with my neighbors, and I want to bring more people into Sammamish and deal with the issues that we have. So that's why I'm here.
Thank you, Stan.
Nushina?
Right. Thanks, Joyce. And Mark, welcome to the commission. So I have been living in Sammamish for the last 10 years, and I've also raised both my daughters here. The older one is in college, the younger one is applying to colleges. I work at the Bill and Melinda Gates Foundation, so most of my work is on the global health and global development front. And so I really wanted to utilize my background in human services and more direct service provision, by taking on this role on the commission. And so I've been on the commission for the last 4 years, and it has been a real pleasure to work with this group. I really care passionately about many of the areas that we work on. And I'm looking forward to partnering with you going forward.
Great. Thanks, Nushina.
Jody, can you get on to this?
Yep. Hi, Mark. I'm Jody Nishioka. I've been on the commission from the beginning of the commission, but not as early as the task force. And I've been in Sammamish for 25 years. I'm very passionate about human services. I've worked in the sector, either at the government level as a planner in human services departments at the city of Seattle and in other jurisdictions. And I've also worked in the nonprofit sector in the human services area for my entire career. So I'm very involved in that area. And so I'm lending that experience to the commission.
Great. Good deal. Thank you, Jody.
And I'm Joyce Wattenberg. I met Mark on screen. He doesn't remember that.
I do.
Okay, I've been a resident here since '86. And my daughter and 2 grandsons live across the street from us, and I'm retired. I was 35 years in nonprofits in various roles. And I just want to continue with the human services because that's what I've been majoring in all along. And Mark, do you want to introduce yourself?
I would love to. Thank you so much, Joyce. So are you hearing me well?
Yes.
Yes.
Good. Okay. I'm in my friend's office, so I'm kind of adjusting, and all the books behind me are not mine. So I'll just say that you'll never see them again, probably. So my wife and I are in Panama visiting college friends, which goes back to 1983. So it goes back quite a ways, and we are just having a wonderful time here. We moved back to the region 5 years ago to be close to our daughter and son-in-law and our now 3 grandchildren who are ages 8, 5, and 2. And I work for the city of Bellevue as neighborhood outreach manager, which allows me to do quite a bit of knowing about human services, working with City of Bellevue Human Services staff. But a lot of what my role is helping to make Bellevue's tagline, Bellevue Welcomes the World, a reality as much as possible. But a lot of my background has been in human services as well. I've worked as both frontline staff in intensive family preservation, and then managing staff that have done in-home counseling as well. So kind of my passions are kids, and particularly coming through COVID and some of the unknown repercussions of that, and seniors who may be particularly here because of their children's professions, may have moved here from around the world to be here. And then just being a welcoming community and understanding well just the diversity in every respect of the city of Sammamish. I would say also a passion for me is that I want my city to be part of a healthy region, and for Sammamish to contribute the things as individuals and as an organization that make us very strong, to make that part of a strong region. So thank you. Thank you so much for the welcome. It's really great to be here.
Next on the agenda is the election of the chair and the vice chair. Do we go through the memo first, Rita?
Let me see. So yes, so let me just, Mike, can you put the memo up on the share screen, please? I'm gonna screen. I'm just getting
Yes,
used
one
to.
moment.
Actually, let me see. I think I can do this. Okay. So Chair, how would you like to do this then? Would you like to just, hold on. Look at me trying to get used to new technology. Okay. Blimey, you'd think we'd be used to this by now. Okay, share screen. Okay, I've got this. Okay, let's see. Here we go. All right. So you should be seeing this. Do you see this or no? Oh, share. Okay, I have to say share. Okay, here we go.
Yep.
Oh, can you see? All right, fabulous. So Chair, it is up to you. I don't know if you want to just have the commission read through it or go section by section. That's up to you.
Well, I think that Mark probably hasn't seen or heard all of the stuff that goes into how you elect a chair and a vice chair. So I think if we just look at that at this time.
Okay.
So anybody can nominate. They do not require a second. If no further nominations, the chair declares nominations closed. Voting takes place in the order of nominations are made. Commissioners will be asked for a voice vote and a raise of hands. And once a nominee receives a majority, that would be 4, they're declared elected to the position. If nobody receives that majority vote, it moves to the next person there. So, and the process is repeated for the vice chair. So I guess I would ask, is there a nomination for the chair?
I would like to nominate Joyce as the chair.
Are there other nominations? Hearing none. The nomination has been made. Has it been seconded?
I will second that.
Thank you, Julie. All right, it's been moved in second. Is there discussion? There being no discussion, the motion has been made to elect Joyce as chair. All those in favor say aye.
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 Okay, were there any nays in that? I thought I saw action on everybody's screen. Then we move into the election of vice chair. Do we have nominations for vice chair?
I'll nominate Julie for vice chair.
Don't need a second.
I will second it.
We don't need a
We
second,
don't need a
but
second.
that's okay.
Okay. All right. Are there any other nominations for vice chair? There being none. The nomination has been made for Julie to serve as vice chair. All those in favor, wave or say aye.
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 Thank you. Julie, welcome as vice chair.
Thank you.
Okay, then we move to the review and approve the bylaws. This is an annual review that we need to do. You're going to put that up on the screen too? In all fairness, we've been doing this on team meetings, which has totally confused me. So now we've moved to Zoom and we're totally confusing Rita.
Rita, you're muted. If you need my assistance, I'm happy to share something.
Oh my gosh, I'm so sorry. This is ridiculous. Mike, do you mind sharing the bylaws, please?
Sure.
Thank you.
Everybody can see this, right?
Yeah.
Okay, I'm not so sure we need to read everything. Does anybody have any questions about what they have read? This came out to you on Friday. It's the same thing you saw last year. Know that we are appointed by the council, that we are advisory capacity in this. And is there any way that we could see a page at a time? It's kind of tiny that way, yeah. Okay. You can see the list of 6 duties and responsibilities. Our last assessment of human services was in 2017, published in a book presented to the council in 2018. If you need to review it again, it's quite interesting. I'm just wondering what it's like 5 years later. The purpose of the assessment was to determine the priorities of service needs, which, you know, at that time was a focus of 5. We evaluate and recommend funding requests. Now, this is the year for it, and it will be for the 23-24 biennial years. And if it's anything like last time, we get about 70 applications of at least 8 pages each. And we have a $440,000 budget that we're supposed to stay within. And it'll start there in that April time period. Okay, I don't think we need to go through the officers part. Next page, Mike. Okay, we don't have to go through elections and the duties, the meetings. Okay, you're going to see that you've seen the calendar of events that was submitted with the materials back on Friday. And we will be monthly. There's a couple of months where we may have an alternate in our second Wednesday schedule. We will not meet in August as an official meeting, but I'm going to bet we're going to have some subgroup meetings because we'll be at that point very in the midst of the grant proposals. That if we have a special meeting, it must be under 4 people. We have 7 members of our commission, but if you have 4 or more, we're subject to the public notice and being an official meeting. So we go to 3. That's pretty much it. Did anybody have any questions about what they remember or what they've read this time? Okay. I think we can move on from that agenda item, which goes us into the, do we approve the bylaws now with a vote?
Chair Bottenberg, if you are prepared to adopt the bylaws tonight, that would be great. Or if you want to think about it, we could bring it back in March if there are any amendments or proposals.
Does anybody think we need to think about it? Everybody ready to move to the approval of the bylaws as presented? Okay, can we have a motion to approve the bylaws as presented?
I'll make a motion to accept the bylaws as written.
Do we have a second?
I will second it.
Oh, thank you, Rich. Do we have discussion? There being no discussion, we move to the approval of the bylaws. This could be a short meeting. All those in favor of the bylaws as presented, wave. Okay, it's unanimous. Thank you all. And the calendar. Rita, do you want to speak to the calendar? It was in your materials.
Does everybody see the calendar there?
Yes.
All right, great. So I'm just going to go through the 2022 long-term calendar for the commission. So we're in February, that's a given. So our next commission meeting is going to be in March, and that's going to be part of the joint Human Services Commission meeting. Traditionally, twice a year, we meet with our sister cities from Bellevue, Redmond, Kirkland, and Issaquah. And we, discuss and meet and work on something together. So if you recall, 2 years ago, we had Sarah Tran do some equity training with the commission before we reviewed the applications. And this year, what we're planning to do is that we're going to have a presentation workshop by an organization called Lunas Consulting. And they've worked with cities from South King County in the last grant cycle. So we've heard good things from them. And the whole premise of this presentation, PowerPoint workshop, will be about equitable grant-making principles and practices. So the purpose of this meeting is really to support commissioners develop a racial equity lens in their grant making. And the hope is for everyone to build familiarity and comfort with DEI concepts and issues in grant making. So there will be 2 opportunities. We haven't nailed down dates yet, but there'll be 2 or 3 opportunities for commissioners to choose a day or time that works for them. And then you'll meet and you'll be in a meeting with other commissioners from other cities as well. So that's going to be happening in March. And as soon as we get those dates, I will let the commission know. Also, just for your reference, we have the start dates and closing dates of the application. So the human service funding applications open on March the 14th and close on April the 28th. In our April meeting, we will have just an overview of the grant program. We'll talk about grant criteria discussion. I know the commission, every time we review grants, we kind of, the commission traditionally has always looked at what they've done in the past and whether that's still relevant, and they want to still keep that criteria going forward. And then we'll also have the grant review assignments. So if you recall, and for you, Mark, we have, as Chair Bottenberg said, we have many, many applications come in, like 70, 80 applications. They are long, long applications. And obviously, as commissioners, you're welcome to read all of them. But what we have done in the past is that we've broken up into groups of 2 and 3, small groups, and they deep dive into certain subject areas and then come back to present to the commission. So that will be our Wednesday meeting. And then our May meeting, we have it down. Traditionally, our commission meetings are always the 2nd Wednesday of the month. For May, we are suggesting as staff that we have it on the 3rd Wednesday, and that will be May the 18th. The reason being is that with grants closing, and by the time we download them and get them to you as commissioners, we think it would be too fast a turnaround for a small group to deep dive and come back to the commission. So our request is that we, if it's the will of the commission, if everyone's okay with it, that we push it out to the 3rd Wednesday, thereby allowing time for all commissioners to get the grants and review them. So Chair, I don't know if you want to ask the commission what their thoughts are, if anyone has any objections to that, or.
Does everybody have their May calendar? Any concern about moving from to a 3rd Wednesday?
No.
Sounds comfortable
Is
right
it-
now.
Is it possible to do another day? I may have a conflict in.
Sure. Commissioner Merritt, why don't we do this? Just get back to me, and then as soon as, we still have time, and the only thing is we have to notice it. So I'm sure we can, just let me know, and we'll figure it out, and try and set something up for everyone that's convenient for everyone.
Great, thank you.
Yeah. So then we also, so then in May, we'll have the first reviews, and this will be reviewing seniors, cultural inclusion, and domestic violence. And the reason why we've got those groups is that they traditionally tend to have the least amount of applications. Mental wellness and basic needs, as you may recall, have a lot more in those subgroups. And then June, we have application reviews for mental wellness, and July, basic needs. And then we're going to be discussing final recommendations. And as you recall, as a commission, you all do a great job of bringing back to the rest of the commission your recommendations. And then that's the meeting where we have this fabulous spreadsheet that Mike brings up, and we have this number and we've got to get to this number, and somehow as commissioners you do a great job of getting there. And also we anticipate there maybe being an additional meeting, and we don't have it on the calendar yet, but traditionally we may have had to have an additional meeting in July or August. So we haven't got it on the calendar yet. I think we'll just see, how it goes, and then we'll add as needed. And then in our September meeting, we will be, as a commission, you'll be confirming a recommendation to the City Council and discussing the handoff to City Council. And then the proposal is that as a commission, you go to City Council on October the 11th to present your recommendations. And then October is a to be determined, because we think there will be a joint human services meeting there. We're not sure about the topic. And then November, it will be a presentation from the Eastside Human Services Forum. The commission have not heard from this forum, and we're a part of it. And it's a forum that's made up of elected officials, cities, non-profits, hospitals, and it's quite a robust, hefty powerhouse on the East Side with regards to legislation and impact. So we thought they have an executive director, and we thought it'd be great for them to come and present. And then December, we see year in review. So any questions from the commission?
I have one.
Sure.
When we go out with solicitations for grants, do we have any, how do we get somebody added to it, or how does someone get added to the list? I noticed in the past we haven't had any drug and rehab, and I think it needs to be addressed.
Yeah, that's a great question, Commissioner Gunno. So I know that as a city, when we get the grant, sort of it's all being finalized right now, with the grant applications and when they're going to have a presentation and walking people through, how to fill out an application. But once we get all that information, we'll do a press release, and we'll robustly sort of message that out as a city. I know for me personally, I will send out to all organizations that have been funded, all organizations that have applied that have not been funded, all organizations that have never applied for funding, community groups, and just anyone on my list. And obviously that would be great as commissioners, if you know of any groups. I will say, and I will urge, if an organization has not applied for funding, please ask them to come and reach out to me, because it's a lot for an organization that's not applied for funding. There's lots of caveats, there's lots of, dot your I's, cross your T's, and I'm very, very happy, and I've done this in the past, to walk through an application and explain, all the things that are needed. There will be a presentation that will be recorded with all the cities going through the application, but also I'm very happy to speak with people one-on-one.
Yeah. Rita, do you have put on a workshop maybe that we could videotape on?
Yes, we do. Yes, that's a great. Yeah. So what we do is that my peer in Redmond, Alaric, he traditionally always just goes through the application and he takes answers, and then we video that. Before COVID, we would sit at Redmond City Hall and they'd all come, but we record that and it's available, for all organizations to see as well. But again, Commissioner Banak, I would really urge, if anybody wants to apply, yes, they can absolutely come to all the presentation meetings, but, reach out, connect with me, and, I'm happy to walk, folks through what's needed. So, yeah.
So, hi, it's Jody. I have a question. So we get the applications closes on April 28th. And then you guys have to, you do a first read through of everything, or do you just divide it up among them?
Traditionally,
get it, because that doesn't leave a whole lot of time for us to do.
Yeah.
2 weeks?
So what we'll do is that once it closes, I know in the past we've we work as I work very closely with my peers, and in the past Kirkland has always downloaded everything. I know that time is of the essence, so I think we may have to do that. And then what Mike and I will do is that we will go through and categorize them into the 5 subgroups. And then I always will have read them, because, I know that, there's a long version and there's a short version. By that point, I've definitely done all the short versions. And then when you get together as subgroups, like I've looked at the long version, so I'm also there to answer any questions and,
So since you have to do all that, I'm just wondering what your expectation is. Will we get it by the following week?
Yeah,
I'm just
yeah. Yeah, well, I'm thinking, and like maybe Mike is with this, it's electronic. Once it's closed, it's closed. I mean, like everything surely should be fairly simple. I say that, I'm a complete Luddite, but we do know that we need to get these to you guys as quick as possible, so that you guys could at least have the opportunity to sort of review for sure. So, I'm saying by the Monday for sure.
Okay, that's cool.
Yeah.
And then we know for sure we're meeting on October 11th. It's not on this calendar, but the October 11th is the date that we're presenting to.
Yeah, let me confirm that with Mike. I think that's tentative right now, Commissioner Nishioka. Mike, can you speak to that?
We've penciled ourselves in on the planning calendar that we use to plan forward for council meetings, but that may change just based on the timing of the commission's review and just based on everything else that the council has going on. So that can be moved if needed.
Okay. I just think it's the more of us there, the better, because it's more pressure on them to accept our recommendations. At least that's what I felt in the past. The more presence we have, the better. So just wanted to say, if that is a secure date, that I would urge all the commissioners to put on their calendar.
Yeah, and Commissioner Nishioka, once we get that confirmed, we'll definitely put that in the calendar. Yeah.
Sounds good.
Okay, any other questions?
What we did 2 years ago was, I think each of us were part of a presentation to the council, so that we had specialists talking about mental wellness and seniors and all. Okay. Any questions on the calendar? Okay. The Human Services Needs Assessment, Rita.
I'm getting quite good at this. Okay, can you see the health and needs assessment up there? Okay.
Yep.
So this is a very quick, very broad overview. As commissioners, I know you all have physical copies or electronic copies of the needs assessment, and we kind of always touch base. This is a bit, it's like a North Star, our guiding kind of document. And so we like to touch base on it, every year, just to quickly do a once over. So traditionally, we with the needs assessment, it was first put together, or we had the task force work on this in 2017. So before this, we had never had a needs assessment. Sammamish was always thought of an affluent community that didn't necessarily have human service needs. And so in 2017, the city commissioned its first health and human services needs assessment. And it really was to try and wrap their arms around what the needs of the community were, what the resources were, and the gaps between needs and resources. I love that picture. That's so cute. Okay. So why did we want to complete a needs assessment? To one, establish a baseline, really understand our community. We know it's changing and it's diversifying, but we really wanted to get a sense of that. And also just to help the Human Services Grant Program. So traditionally, when this assessment was being done, we had a task force before the commission, and they were helping, with the grant program, and also just to help understand our role in the regional human services program, especially within the East King County and King County position. So we had a needs assessment to try and understand our community right now, who's providing the community, and what are the range and scale of needs in our community. So the way we did this is that we did a lot of data collection quantitatively. We had data sources such as American Community Survey, Centers for Disease Control and Prevention, Washington Health Youth Survey. And then qualitatively, we had virtual town halls. We had the task force. They did a tremendous job with outreach. I still remember the task force at the farmers market giving out flyers to get people to answer the questionnaire. So we also had interviews and focus groups of nonprofits, community groups, and school districts, really to understand what's going on in the community. So the key findings, so there were two major unmet needs that came up. The first of which was housing. 25% of Sammamish households estimated to be cost burdened, spending 30% or more on housing costs. So clearly this was a significant cause of stress. Residents, are making trade-offs with things like childcare and healthcare in order to pay for housing. And then the second unmet need that was cited was transportation. And this particularly impacts seniors, youth, and the low-income community. So that was definitely the two kind of unmet needs that were kind of like throughout all the assessment that kept on coming up. And then as a task force, they had, all this information, and then they looked at all the information and they identified 5 priority areas. And as you know, like these priority areas are how we define, these are the subgroups for our grant applications. So the 5 priority areas were mental wellness, basic needs, cultural inclusion, seniors, and domestic violence. They're definitely not representative of all the need in Sammamish, but those are the ones that the task force felt that rose to the top and were the most pertinent. So, mental wellness, there's some, some of the findings show that 80% of adults in Sammamish reported experiencing 14 or more bad mental health days in the past 30 days. And I think particularly startling was the mental wellness for the youth. Suicide's a leading cause of death for teenagers aged 15 to 19 years old. And it was particularly jarring, I think, for the commission to sort of see the stats up close and personal. And I think the quote that always sticks with me is, "I saw more like a resume than a person." And that's always stuck with me. That was So that was one of the major findings. Basic needs. A lot of families, are struggling to deal with paying for basic needs. And also experiencing insecurity in things like food, medical care, childcare. And then the poverty status at that time was 3%, and that amounts to 1,500 residents, were at the, poverty level. So, that's a lot of people. Cultural inclusion was another subgroup, a priority area. And we already see, that Sammamish is changing, it's diversifying. We have a much more diversified population. We also heard a lot from youth, talking about having to walk that bicultural walk of going to school and being in the American culture and then coming home and having a different culture and just walking that walk. And then we also, heard that a lot of residents had elder grandparents coming in, and oftentimes they felt kind of quite isolated because of language barriers, etc. And then seniors was our other subgroup. So, we keep on hearing more about, seniors being house poor in Sammamish. And also just the lack of affordable housing and transportation options that are impacting seniors. And last, and very much not by least, domestic violence obviously is impacting people of all backgrounds. And clearly the lack of affordable housing in Sammamish oftentimes exacerbates the impact of people facing domestic violence. They're They're reluctant to leave relationships because they simply just don't know where they can go or where they'd be able to afford shelter. And then also like women from immigrant communities, just, maybe feeling that additional isolation and perhaps not feeling comfortable going outside of their family or cultural or religious group. So that's a roundup of the needs assessment, a very quick touch point, clearly not, yes.
Rita, one of the things I've been concerned about is that I looked at this very, very carefully over the last few months is how much does this really accurately reflect the 2020? I'm thinking, like I said, and Stan had mentioned it, drugs. I mean, we are seeing drugs impacting our, our kids' health, the crime stats. The mental health, we've seen that, it's taken a big toll on our youth. I don't know, is this worth maybe looking at just doing an update to this? I think using some of the grant money so that we really understand what is our current needs, because I just have this feeling this may not be inaccurate. Just housing costs is literally have increased 50% probably since then.
Rita, this was done in 2017, right?
Yes, and it was 2017, and council ratified it in 2018. But yes,
It's old news. It really is.
Hello?
Stan?
I noticed that most of the data sources on here were from 2015 and 2016. So that's 6 and 7 years ago. Is there anything planned to update the statistics that are being reported?
Sorry.
So Rita, I think that's the least we can do. I mean, if it's hard to do a full needs assessment again with the qualitative pieces and the town halls and everything, at least as Stan is suggesting, like one can look at the American Community Survey and some of the secondary data sources, because I'm sure they'll have updated data. Like those data systems lag behind by 1 or 2 years typically, but you still would have data, I'm assuming, from 2019 or 2020.
2019 one.
19, okay.
Yeah. And we know COVID years really changed things too.
Yeah, this is Jody. I agree that it's really old data and things have changed. The problem is if we do it, update it, and we have 2019, it really doesn't include the pandemic.
That's true.
Yeah.
And then things have changed dramatically from that. So I'm not sure. I mean, I think it needs to be updated for sure, but I'm just not sure how to manage that piece. Mike, what do you think? Were you going to say something?
Yes, thank you, Jody. I was just going to mention that I think this is something that we're going to be looking at adding to our work plan for 2023. Obviously, this year the commission is extremely busy with the grant program, as we just saw on the calendar. But typically in our off years, we have some time to focus on other things that are important. So we're going to probably look at trying to get some money in the budget. That's like some of you have said, not a wholesale rewrite of the needs assessment, but more of just a refresh based on current conditions. So we're going to try and push that forward, and hopefully we can try and get started on this work in 2023. But Rita and I will definitely keep the commission apprised of the conversations and whether or not that does in fact make it into the budget, and if we have the authority to move forward with that next year. So definitely stay tuned. I see Commissioner Gano.
One thing that's helped us is our meeting with the providers out there. So we're kind of in touch with what has been happening over the past year. It's just not reflected in the needs assessment.
Agreed. Yeah, there's a lot of great insights that I think the commission can pull from their work last year. I mean, there were significant conversations that we had that really speak to kind of the boots on the ground work that's been done in the current conditions. So I think all of that plus updating the data could, produce a meaningful update to the needs assessment.
My sentiments exactly.
And my guess is that all of those same issues are just worse. It's not that any of them have gone away, right? So if we're going to be funding under those same categories, we still have those issues. They're just more intense with the pandemic. The housing costs are more, I mean, you know, everything, basic needs is going to be more, domestic violence is going to be more. The youth mental health, we know, because we've known, we've had to act on that. So I don't think it's going to affect the reality of our actual grant making. I think it would be really nice to have updated data that we can really feel secure about, but I honestly don't think it's going to make that much of a difference in how we shift between those. There might be something out there that's not on our radar on this particular thing that has risen that we haven't taken into consideration, but which then that to me might be the loss. Like maybe it's, I don't know, economic development, job workforce, or I don't know. I'm not really sure what it would be, but there might be something else out there that's off our radar, but all the things that are on there are not gone, have not gone away. They've just gone worse.
And along with this needs assessment, wasn't there like, did we go through a strategic planning process through which we identified the priority areas? I don't remember what the process was because I was not in the initial workforce, the working group.
Well, I go back to the task force. I was there. Yeah, and there was a lot of discussion. Things had been managed by the city clerk for the grant process and all, and getting the information and making the recommendations to the council. And to our first meeting, it was like, oh, that's an awful lot of work for that one staff position. This is exactly why the task force was made. And of course, coming up with a needs assessment, we interviewed probably 5 different providers of that and to try to get the information that we needed and hopefully to get enough input from our own community, not just the service organizations themselves, but the people there, and to move forward. But the problem is that what I see is the same as what you're just saying, that much of the data came from 2015 and 16. 2017 was the wrap up with the Burke study that was presented again, as you know, in March of 2018. So it's old news. But like Jody is saying, I think we are seeing that we still have those 5 priority areas. They just may have different priorities within them now. We know that the federal stimulus monies did some things and didn't do some things. So I think we'll read a lot about it in the 8 to 12 pages we get on each of these grant applications. Stan?
Yeah, if you recall, we did put a strategic plan forward to the council.
Yeah.
And it got kicked back based on a couple of issues. We never revisited the strategic plan. We had discussed revisiting it, but last year we got busy and just didn't get to it. But I think it is something that's valid that we do need to address.
And I brought up the strategic plan, Stan, because if we were to do another needs assessment, it should be tied to the strategic planning process. The two should be linked, you know, so you do a needs assessment and then you use the data to inform your strategic planning. Like just doing a one-off exercise, you know, may not be as useful. And that may be an opportunity to revisit some of the areas that we've talked about that need to be revisited, like cultural inclusion, because of the way it was envisioned originally.
I agree.
Can I? Oh, sorry.
Rita, you have your hand up?
I will see. I know Commissioner Barnes wanted to speak. I can speak at the end. That's fine. Thank you.
Oh, sorry. I just wanted to ask, just to follow up on Stan's comment that the city council kicked it back to the commission. Why did they do that? And what were they hoping, you know, in return, or what would come back?
One of the issues was in the strategic plan that we put forward, it was a recommendation there that we increased staff. And it wasn't our place to put that forward. That was up to the city manager. That was one of the issues. Mike, do you and Rita recall the other issues that came up? I think
It's
there were
been
two.
so long, I would need to revisit
Yeah.
my notes on that one.
I know that was one of them. That
Okay.
was probably the biggest one.
Thank you.
Chair, may I suggest, we're talking about needs assessment and sort of getting updated data, and I'm hearing you guys, and I know, with this year with grant review, there's a lot going on. I know that the City of Bellevue does every 2 years, does like a needs update, and I'm wondering if that would be something that I can I can ask them if they'd be willing to share that. And even though Bellevue maybe has, I'm sure there's a lot of the same issues that we're dealing with as well. It's not Sammamish focused, but I'm sure there's an East Side focus there. So I don't know if that's something that the commission would like to sort of look at and just have. I'm happy to sort of ask and request that and forward that on to you.
That would be great to see. Like I said, they're doing a lot of the work. And like you said, there's probably more than a little overlap. They have some similar issues. So I'd love to hear that.
If I could mention, I do know that document is in PDF form online, and I think it was done, I can't remember which year it was, kind of lost track of what years or what, but there is an executive summary, I think a couple of pages, and then kind of the full, I want to say it's like 45 or 60 pages long summary. So if you want to get an idea of the most recent summary and even some of their categories and that sort of thing, that is something that's publicly accessible. And I'd be glad to send that on and track it down if it is publicly accessible.
Sounds great. Yes, please.
Yep, I'll do that.
Anything more on the needs assessment? Rita, and the end of year grant reporting.
Okay. So we have all Q4 reporting in, and I'm just gonna, everyone was good, but like a good teacher that I am, I'm gonna tell about the naughty kids in the block, right? The ones that kind of so if you didn't hear from anyone, just assume they're good. Actually they're all fantastic, these nonprofits, but Teen Link, they're proper teams. So for some reason, we've had to withhold payment from them for Q3 and Q4. And I don't know quite why that is. We've met with them as cities a number of times. We think, we know that they've had a lot of significant staff turnover. And I don't know if that's part of just the general overall trend of staff turnover with the nonprofits. This is a hard industry to be in. But anyway, so they are behind on all their service units. They had only achieved 44% of calls, texts, and chats to support lines, and only 4% of their service unit 3 goal, which was suicide prevention training in middle and high schools. And so I think it's they keep on changing staff, and we keep on trying to meet with them, and we're trying to be supportive. And this is not just for us, this is just also for the other cities as well. So, this is a program, and I keep on saying this when I meet staff at Teen Link at Crisis Connection, that this is a program that the Sammamish Human Services Commission passionately believes in. And, we're very excited about it, and we want you to succeed. So we're really trying to egg them along and try and see how we can help. So Eastside Friends of Seniors, they were short on their transportation goals, but they almost doubled their in-home care and chore service goals and tripled their information and referral goals. So they did great. Imagine Housing, as you recall, we fund Imagine Housing, the Highland Gardens, low housing development. And so payment was withheld in Q2 due to lack of service units. And again, this was a staffing issue because they didn't have a case manager there. But the good news is that they have a full-time case manager there, which is great. They have fallen behind on their service units for workshops and presentations. And that's simply because people just don't want to be on a Zoom call learning about something. So, but they have, done great in all the other service areas. Let's see, CrossPath, as you recall, the commission funds a full-time counselor at CrossPath, and they have 2 service units. The first service unit is for counselling sessions, and they far exceeded their target of 750 counselling hours, and they achieved 824. And the service unit goal was slightly under goal. The goal was 150 assessment and referrals, and instead they have 135. But, you know, again, this is a great service for residents. As you recall, this assessment and referral option is when residents can call them, and either the same day or the next day, the council will call them back and do a very long, extensive intake with them. And if they cannot see the person that needs to be seen at cross-path counselling, they will find and do a soft handoff to someone that accepts their insurance and connects them to folks. So, you know, in last year, cross-path with that one full-time counsellor that you funded helped 218 residents in 2021. Let's see, as far as, I'm going to jump now to staff reporting. Corey Walters, the Executive Director of Issachar Food and Clothing Bank, has left. It's so sad. She was there for 11 years. I loved Corey Walters because she always came from a place of yes, which was wonderful. But they're looking for a new executive director, but they've got a great team there, and you know, they're in good hands. The EPRAP program, you know, as you know, King County funds the EPRAP program, which is the Eviction Prevention Rental Assistance Program. And they were off to a slow start in 2021, but they've taken off towards the end of the year. Since June 2021, EPRAP has expended 169 million to stabilize 15,000 households. And this is in addition to the 49 million that King County spent from August 2020 to June 2021, which helped 11,631 households. Currently, they're basically running out of money now, King County. I mean, they've done a great job of getting that money out the door. But currently they have 11,000 households that are pre-registered for the program, but they haven't been assigned. So they're not sure if they can actually help these households, and it's all dependent if they can receive additional funding. So I know that King County is looking at additional funding from the state of Washington and the Treasury, and they haven't heard back. But so far for EPRAP, they have 45,000 households that express interest in rental assistance. They've helped 33,965. They've helped 33,965 households. The average amount per household they've funded is 11,300, and they've basically given a 9 months back rent and 3 months in advance for rent. So we're just waiting to hear what's going to happen with regards to that extra funding. And that's it for my staff reports, Chair. So any questions?
Do we know what affordable housing assistance has been made by St. Vincent de Paul and others?
Yes, we have. I know that they've expended all their money, so I'm tracking. So whatever we funded them, they've been able to use all their allocation. Yeah, but I am paying very close attention with rental assistance providers, because we do know King County have given us the heads up that from February the 11th, they're going to stop accepting all applications for the program. And they don't even know what they're going to do right now, because they need to find more funding sources. So as staff, we're just making sure just to keep in close contact with our 3 main rental assistance providers.
No, this is all for rent. It's not for mortgages.
No. It's rent. Yes, rent and utility. Yeah.
Any questions to Rita? Other than, can we have those in writing so we can see the numbers?
Oh, sure. Would you like for the EPRAP program?
Yeah.
Oh, yes.
Hearing
There's
the
a
dollars
great,
and the
yes.
numbers and percentages. And
I'm happy to, yes. Yeah, there's a great They have a great blog in King County, and it's great because they've got a very easy to read, and I'm very happy to forward that onto the commission for sure.
That'd be good. All right, does our commissioners have any updates on their own? I can tell you the Sammamish Seniors is still motoring along, talking with the Eastside Friends of Seniors about the potential of a fiscal sponsor relationship so that we are able to accept funding and to move on to get programming. And we're also talking with various entities about a facility, a place to meet, and open up to the when we can get together times. Of course, there's been so much of this masking, safe distancing back and forth and up and down that it's kind of hard to project when we can get in person again, especially when we see that our neighboring communities have done the same way. They've just gone Zoom, gone hybrid, had a few in person, and are back to being hybrid.
So how are you doing on finding the senior center? Is that any luck there, or are you thinking this year?
Well, there's always the teen center for partial meetings because it has to be used for children. That's the whole purpose of it being rented to the Boys and Girls Club for $1. And so we're looking at property that has come to the city by the Piggott donation of land. We're looking at potentially of taking on a few things at the meeting rooms within the YMCA during non-school time so that we're not competing with the kids coming in or going out after school, and just looking at options perhaps in a couple of churches being able to hold things. So it might turn out to the Redmond study, which of course their facility was taken down a couple of years ago, and they have a new one that's being built that will be ready for them in 2023. It's a senior/community center with all the kind of things that Mercer Island has, for that matter. It's about a $44 million project, and it has now another $20 million worth of additional expenses. So how would we be able to get something like that? There's conversations with members of the council. There's conversations that we have with our recreation manager about beefing up programs that's specific to seniors and not just walks in the park. There's conversations going. And there's probably 20 of us that are active on it. Stan's part of that org team too. Anybody else want to join that? You're welcome.
I don't know, that treehouse looked like it'd be a fun place to have a senior center.
I think you can get 20 people in there, right? If they can walk up the stairs. Yeah, there's no elevator or easy ramp for getting there. It's a beautiful building.
So,
have you had a tour of that one yet? It's fantastic.
I have.
It's a bunk room and all up there.
Yep.
Stan?
So Rich, how did you do your self-protection class or self-defense class?
I did 3 of them last year, so I'm actually planning to do a new one, another one. I'm also debating to actually do an in-person. I'm hearing mixed feelings on people doing that, but I've done, like I said, some of the Zoom ones, and it's pretty much open to everybody. I'm looking for a place, I think, up in Redmond. But if there's much interest, it's basically a 2-hour presentation on, hey, situational awareness, conflict de-escalation, and just a lot of the soft skills, on, how to keep yourself safe. Because what I'm definitely hearing a lot on the social media is people are getting a lot more nervous, and, definitely about going into Seattle, but even here in Sammamish. But no, I'll definitely look at doing that and let you know and an update on that.
Are the
Thank you.
rooms available to you?
Sorry, what was that?
Are the 2 YMCA public rooms available to you?
That's an interesting idea. I could check on that. That would be
There's
great.
a Rotary room and a Metropolitan room as you enter the building.
Yeah.
and they can be reserved for community groups. And you can be called a community group.
Yeah. Well, thank you. I'll look into that. That's a great suggestion.
Julie?
Joyce, I wondered if you could give us an update on the Rotary, the Christmas tree sale. I wonder how successful that was.
It was very successful. We expected to sell 150 trees and sell 364. We netted over 13,000, which takes care of our being able to do the scholarships for the high schools and the vocational schools this year. So that's pretty phenomenal.
Excellent.
It's not like the nightmare at Beaver Lake, though, which netted 150,000. So we need to grow it. We need to be a little bit more public than being buried in, Pine Lake Park there. But it worked out very well, and we had a lot of fun. We all wore masks. Lots of good conversations with the community too. Well, is there anything else for the good of the order? Is there a motion to adjourn?
I'll move to adjourn.
Okay,
Second.
Jody, a second? Is that you, Nashina?
I'll
Oh.
second.
Okay. Okay, this may be one of the shortest ones, but we have one that was about 45 minutes one time. All right, it's been moved and we have a second. We don't need to vote on it. We can just sort of say we are adjourned. See
Great.
you in March, everybody.
Fabulous.
Thanks
Thank
for the
you.
welcome.
Bye.
Welcome, Mark.
Bye.
Thank
Thanks.
you.
Look forward to
Bye.
getting